the occasion is for the official launch of the Global Fund Grant Circle, that's Circle 7, for the people of Liberia. So if you're there and already know, watching your comments coming in, thanks for being there, thanks for viewing. The singing of the national anthem of the Republic of Liberia. This program is just
Your Excellency, President of the Republic of Liberia, distinguished members of the High Table, senior cabinet ministers and other officials of government present, members of the diplomatic corps, members of the donor community and health partners, heads of international and local organizations present, members of the civil society organization, members of the Fourth Estate, distinguished guests, ladies and gentlemen. Good morning and welcome to the official launch of the Global Fund Grant Cycle 7 for the people of Liberia. The launch of the Global Fund Grant Cycle 7 represents a landmark event in Liberia's battle against HIV, TB, and malaria, as well as our commitment to strengthen national health systems. This occasion gathers the President of the Republic of Liberia, His Excellency Joseph Boakai, distinguished guests, including government officials, international partners, civil society representatives. Today, we reaffirm our collective resolve in addressing the critical health challenges faced by Liberians and commit to forging a pathway to leveraging the gains we've made. We've already sung our national anthem, instilling a sense of national pride and unity. Afterwards, there will be a moment of quiet reflection to honor those impacted by HIV, TB, and malaria, and reinforce our solemn commitment to combat these diseases. Following the reflection, there will be recognition of our platform guests, whose presence today underscores the importance of this collaboration and signifies our nation's commitment to the Global Fund's efforts. Dr. Catherine T. Cooper, Deputy Minister of Health Services at the Ministry of Health, and Chief Medical Officer of the Republic of Liberia, will make welcome remarks highlighting the health sector's dedication to the cause and setting the tone for collaboration. Ms. Joyce L. Kilipo, Chair of the Liberia Coordinating Mechanism, will provide a comprehensive summary of the Global Fund investment in Liberia and its support to the country. This summary will provide insights into strategic allocation of resources and the expected impact of these investments on Liberia's health landscape. The program features a series of special statements from key partners. Statements will be delivered by representatives from Plan International, Catholic Relief Services Liberia, the Global Fund, our donor partners, and other prominent organizations. Each speaker will highlight their organization's contribution and perspectives of the GC7 initiatives, emphasizing the power of collaboration in achieving our common goals. A pivotal moment into this program is the special statement and official launching of the GC7 by His Excellency President Joseph Boakai. His address will highlight the national vision and strategic priorities underscoring our government's unwavering commitment to enhancing health outcomes for all Liberians. The President's statement will be followed by a presentation of a symbolic check and the official signing ceremony by Mrs. Cathy Falstaff, head of the Africa and Middle East Department of the Global Fund, symbolizing our formal commencement of the GC7 efforts in Liberia. The Honorable Minister of Health, Dr. Louis M. Koto, will then extend a vote of thanks expressing gratitude to all partners and stakeholders for their invaluable contribution to the Global Fund initiatives. Her remarks will reinforce the importance of sustained collaboration and the collective effort required to combat these diseases effectively. The event then concludes with the announcement of official photographs, providing an opportunity to capture the occasion. A lunch will follow, offering invitees a chance to network and discuss in a more informal setting. Ladies and gentlemen, this is an overview of the program.
All right, formal overview.
We will now have individual quiet reflections.
Individual quiet reflections, as you heard. We'll allow them to reminisce and, of course, forge ahead as far as these initiatives will be concerned. The issue of HIV and AIDS, malaria, tuberculosis, and others.
May the source of all we've lost to malaria, TB, and HIV rest in perfect peace. It is now my distinct pleasure to call Dr. Catherine T. Cooper, Deputy Minister of Health Services and Chief Medical Officer of Liberia, to provide welcome remarks.
Catherine Cooper, the Minister of Health for Health Services and the Chief Medical Officer.
His Excellency President Joseph Dima Boakai, President of the Republic of Liberia, please allow me to stand on the protocol that has been set by our MC. Distinguished ladies and gentlemen, it gives me great honor and privilege to welcome all of our esteemed guests to the launch of the Global Fund Grant Cycle 7 for Liberia. Today we gather not to celebrate the allocation of these vital resources, but to reaffirm our unwavering commitment to the fight against HIV, TB, and malaria. The Global Fund, for over 2 decades, has been a steadfast partner in our efforts to provide the critical support needed to save lives, prevent new infections, and build a resilient health system. They have made significant investments in the Liberia health sector, focusing on HIV, TB, malaria, and health system strengthening. These investments have helped us to place over 26,000 persons on antiretroviral treatment, achieve a 77% treatment success rate for all forms of TB, and ensured ownership of insecticide-treated nets increasing from 47% in 2009 to 72% in 2022, just to name a few. The investments for this allocation cycle 2024 to June 2027 is critical as we continue to build our health system with a focus on strengthening the supply chain system, procurement of commodities and equipment for HIV, TB, and malaria that will help our case detection and treatment rates. This new grant cycle represents a renewed hope and a brighter future for our nation. It is a testament to the enduring partnership between the Global Fund and the people of Liberia, and to our shared vision of a healthier, more prosperous country. As we launch this new phase of our collaboration, we invite you to join us in sharing our successes against the 3 diseases over the 2 decades. However, we also invite you to reflect on the challenges ahead in our fight to ensure that no lives are lost due to HIV, TB, or malaria. We remain grateful for the opportunity that this new investment has brought to our citizens afflicted by these diseases, and affirm our commitment to ensure that the funding reaches and changes the lives of the most vulnerable of our population. Thank you and welcome to this historic occasion.
And this is the Chief Medical Officer of the Republic of Liberia and Deputy Minister for Health Services at the Ministry of Health and Social Welfare.
Thank you, Dr. Cooper. A summary of the GC7 investment and the Global Fund's background in Liberia will now be provided by Ms. Joyce Kilipo, the chair of the Liberia Coordinating Mechanism.
Right, Joyce Kilipo makes her way to the podium, and we're coming to you live on the Executive Mansion online platform.
Your Excellency, Ambassador Josiah Boakai, President, Republic of Liberia, kindly permit me to stand on existing protocol. Ladies and gentlemen, one and more. One may be asking today, where's the presentation? But hey, I'm here. I'm going to do the presentation due to some technical reason. We couldn't project. However, I will give some highlights as it relates to the investment thus far. One may be asking, what is the Global Fund? Global Fund is an innovative funding mechanism that brings about a strategic partnership between government, civil society, private sector, international organization, as it relates to fighting the 3 diseases, TB, HIV, and malaria. The purpose definitely is to dramatically increase resources to fight these 3 diseases and ensure that resources and services reach to the most needed people. Global Fund does not have a country presence. It is coordinated by a body called the Country Coordinating Mechanism. In Liberia, we call ours the Liberia Coordinating Mechanism, for which I serve as the chair. The purpose of the Country Coordinating Mechanism is to lead the development and submission of funding application to the Global Fund on behalf of the country. In Liberia, the Country Coordinating Mechanism, which we call the Liberia Coordinating Mechanism, was established in 2006. This mechanism nominates principal recipients to execute the grants awarded by the Global Fund, oversees grant implementation, basically providing oversight for the investment, and also ensure linkages and consistency between Global Fund and other international investment, other health investment in Liberia as well. To date, since 2004 to 2027, Global Fund has strategically invested $457 million. At the LCM, before we go about with grant application and so forth, there's a process called allocations of funds for the grant cycle. The grant cycle runs for 3 years. So the LCM receive allocation letter that is directed to the Minister of Health and the Ministry of Finance, and also to the coordinating mechanism. Once that allocation letter is made, the LCM coordinates with stakeholders on behalf of the country to begin a nationwide country dialogue to development, finalization, and submission of the country proposal for approval by the Global Fund. As of this cycle, which is GC Cycle 7, the Global Fund has allocated 93 million to Liberia, and that 93 million allocation period covers 2024 January to 2026 for TB HIV, which amounts to 45 million, And then there's the second grant cycle that runs from July 2024 to June 2027 that is being implemented by CRS, and it amounts to 48 million, bringing the total to 93 million. One may ask, what does this 93 million cover? So basically it covers TB, HIV, and resilient health system strengthening, as well as malaria. So basically for TB, HIV, this funding is going to ensure procurement of all HIV and TB test kits and commodities in the health sector, including PrEP, for the grant period. It's also going to extensively support nationwide supply chain for health commodities across the 15 counties. This grant also is going to do procurement of insecticide-treated treated nets for the prevention of malaria within the population, ensure malaria commodity at the last mile in the hands of the community health assistant, and also ensure that we also have rapid diagnostic test kits for malaria. Additionally, this grant is going to support community health assistant program in the counties. We all know that community health assistant program accounts for 47% of the rural population access to health services, and also it's going to support TB case finding at the community level and support testing and adherence for services. Outside of that 93 million grant allocation, there is a special initiative that came about with COVID-19, and we call that the C-19 Response Mechanism Investment. So basically, that investment is 34 million, but of that 34 million, 10 million has already been expended since January 2021 to December 2023. We are now left with 24 million that should be expended as of December 2025. That COVID-19 response mechanism covers key things, and basically it's meant to support laboratory system strengthening. We know that there's no health system if we do not have a diagnostic system that supports and gives us information as to what exactly is happening to us. So this fund is supporting improvement of our laboratory system in Liberia. It also supporting procurement, construction, and sonorization of 4 additional regional oxygen plants in Liberia to support oxygen needs during health emergency. We saw that with COVID-19, there was a huge need for oxygen, and it is out of that need that this investment was made to Liberia. These plants are located in Lofa, Nima, Grand Jide, and Grand Kru. Additionally, the COVID-19 investment fund is also supporting waste management and building 2 regional incinerators to support healthcare waste across the country. As you all can remember, there was a time in Grand Bassa where healthcare waste sat for almost a year. So this shows that we have a huge need to support healthcare waste across the country. Additionally, the C-19 investment is also going to support integrated sample transportation across the 15 counties with priority on the 3 diseases, HIV, TB, and other infectious diseases. And Global Fund is Global Fund of the people, is Global Fund of the country, is Global Fund that is huge on country ownership. And with that, there is a part of it that we call co-financing commitment. In Liberia, we say, when somebody washing your back, you should wash your front. So with that, with the commitment, the co-financing enrichment calls for 15% of the grant allocation for that cycle to be committed by the government through its national budget. This means that the health sector is going to ensure that 15% of the investment across the 2 investment streams covers the 3 years period, and this Co-financing doesn't cover salaries as co-financing. So it means we need tangible investment in the health sector that comes from the government to also buttress the efforts of the funds across the country. And so far, one of the gains that we have with the co-financing arrangement was that before the previous leadership left, there was a co-sign letter, a co-financing letter that was signed by the previous administration and identified the 15% that was proposed by government to spend during the 3 years period of the grant. We believe that the government is committed to ensuring country ownership and leadership, and that is why today we have His Excellency President Joseph Boakai here with us, giving the highest level of support, and we as citizenry of this country highly appreciate the commitment of the government to ensure this. Thank you, and God bless us.
Program will continue at that point, at least a little insight into what this is all about and what happens and what goes where in terms of funding. Who are those the funders, who are the partners, and other pieces of information.
Thank you, Ms. Kedeko.
But let's go back to the podium.
We'll now have special statements. First, with the country director of Plan International, Ms. Mariam Murray, or her proxy.
All right, so Ms. Mariam Murray
International
is obviously not present.
Special statements will come, beginning with Plan International. Keep viewing from where you are.
On the launch of this,
we're live on the Executive Mansion online platform.
So let's go to the
and as I said, I'm Emmanuel Kippard with you.
Sorry, Mr. Miriam, she's not she's out of the country, and she's appointed me to represent her, please. His Excellency Joseph Boakai, President of the Republic of Liberia, the Minister of Finance and Development Planning, Honorable Bona Kabara, the Minister of Health, Dr. Louis Boto, and other senior officials of the Ministry of Health. Mrs. Katie Forster, Head Africa and Middle East Department Global Fund, the U.S. Ambassador accredited to Liberia, Ambassador Catherine Rodriguez, the UN Resident Coordinator in Liberia, Marie-Christine N. Tony, other distinguished ambassadors accredited near Monrovia, the chairperson of the Liberia Coordinating Mechanism, Ms. Joyce Kelly-Boo, the chairperson of the National AIDS Commission, Dr. Cecilia Nuta, members of One UN Family, civil society partners here present, members of the Fourth Estate here present, all other protocol observers. Today is really a fascinating day for the global Plan International family. I therefore bring your warm felicitation from our global, regional, world, and national organizations of Plan overseas. We are happy that the GC7 integrated HLETB, RCCH, and malaria grants are being launched today by His Excellency the President of Liberia. We join the Ministry of the Health and the Government of Liberia in welcoming Mrs. Katie Forso, Head African and Middle East Department Global Fund, and her team to Liberia, who have come to be part of these special occasions. Plan International Liberia is indeed excited to have been selected by the Liberian Coordinating Mechanism, LCM, to be a principal recipient partner to the Ministry of the Health in the implementation of the GC7 grant. Our responsibility will be to serve as the principal recipient of the GC7 HIV-TB integrated grant with the second wave of the COVID-19 grant, as well as major sub-recipient for the malaria grants. Be the PR for the GC7 TB HIV RSH grant and C19 RM funding. Plan International is tasked with working with the National AIDS Control Program and other stakeholders to improve access to HIV prevention, care and treatment service, particularly among key and vulnerable populations. PLAN will also work closely with the National Leprosy and TB Control Program to improve TB case notification and treatment outcomes in the country. In addition to that, with support to the COVID-19 funding, PLAN International will work with the MOH to ensure that the health system in Liberia are strengthened, resilient, and sustainable. This will be achieved through improving the overall supply chain management system for medicine and other health commodities, laboratory and diagnosis network optimizations, improving disease surveillance and pandemic preparedness as well, and improving the landscape for the sustainable access to medical oxygen, improving monitoring and evaluation system, and building capacity of the community health care workers. In carrying out grant implementation activities, PLAN International truly recognizes the important national mandate of the Ministry of Health. Thus, it is our desire to maintain and sustain cordial workmanship relationship with the ministry and its different entities, programs, and partners involved in the GC7 grant implementations. The agreement for this grant was signed under the challenging context, but we trust in the mutuality with which we can surmount all challenge and successfully implement the grant with quality, in time, and effectively account for the resources. The GC7 grant adopts a comprehensive implementation approach for HIV/TB and strengthening health system in Liberia. Therefore, working with and through the Ministry of Health and the other civil society sub-recipients represent a truly unique implementation experience. And also, working with the health finance team at the MOH, we pledge to provide all the needed financial updates required for the regular tracking of the disbursement and expenditures to the Ministry of the Health and the Finance for reporting purposes, while at the same time advocating to the government to address the gap in funding to ensure that the current co-financing commitments are met. By these measures, PLAN International will be ensuring that no one gets left behind in the implementation of the National Public Health Disease Program. In this way, in concluding, I want to thank you all, and I wish us all a successful GC7 grant implementation in Liberia. Thanks a lot.
All right, and we have it here from PLAN International.
All right, so
One
we're
of
making
the
the first remark
stakeholders.
Thank you.
here in the special statement segment.
So PLAN International is one of two
Representing,
designated
Ms.
principal
Miriam
recipients of the
Ray,
Global
Director-
Fund grant.
The country director for
That
PLAN
means they're
International
responsible for
Liberia.
implementation of the grant's activities. The second implementing is Catholic Relief Services.
CRS.
We'll now have remarks from the country representative of the CRS, Abna Amedome.
CRS.
So, Madam Abena Abena is the
Program
country
is in progress,
representative of
and
the
also,
Catholic Relief Service.
let's pick it up.
Your Excellency, Honorable President Boakai, please permit me to stand on existing protocols. My name is Abena Medome, and this morning It is my pleasure to represent Catholic Relief Services. CRS as an organization has been entrusted by the Liberian people through the Liberia Coordinating Mechanism and the Global Fund to serve as a principal recipient for GC7 malaria and partner very closely with the Ministry of Health, Plan International, civil society, and collaborate closely with other health actors in Liberia to advance the overall goal of reduction of malaria incidents and death by at least 80% come the end of 2027. Specifically, between July 2024 and June 2027, the project aims to serve all Liberians in all 15 counties, focusing on children under 5 and pregnant women. CRS as an organization is deeply honored to have this opportunity to continue to serve the Liberian people. With a presence in the country since 1957, we have steadfastly partnered with the government of Liberia to address both development and humanitarian priorities. In the health sector, CRS was a key ally during the fight against Ebola virus outbreak. And more recently, in the fight against COVID, we have been close partners with the government. In the last 18 months under NFM3, the malaria grant, CRS has achieved a nationwide outreach, ensuring that malaria testing, treatment, and availability of medication to all required services in the counties across the country. In 2023 alone, we served over 1.5 million people with malaria services in public and private facilities. Since February of this year, we have brought in over 3 million insecticide-treated bed nets into the country for ongoing bed net campaign, which is expected to reach every household across the country. In line with this funding mechanism that was submitted by Liberia for this GC7 grant, there will be an investment of high-value and large-scale activities, such as mass mosquito nets campaign. We are also committed to ensuring that the health workers that are delivering the services to the population are equipped, trained, and benefit from supportive supervision. We are fully aware of the priority that this current administration places on strengthening the supply chain to ensure timely and last-mile delivery of all health products, and our significant and private investment as an organization aligns very closely with this, and it is our priority to better ensure that the outcomes of health in Liberia for all Liberians is achieved. Allow me to publicly reiterate CRS's vision and commitment to local leadership. We are firmly invested as an organization in furthering through partnership backed by excellence and efficiency. While we are the principal recipient for GC7, it is our shared interest that this role eventually is transferred back to the government of Liberia in the future, in the interest of the Liberian people. That is a commitment that we have made as an agency to ensure that local leadership is seen in all of our activities in Liberia. Today, Your Excellency, Honorable Minister of Health, Global Fund Delegation, and all our collaborators, I am honored on behalf of my organization to participate in this launching ceremony. CRS Liberia promises compliance, a commitment to learning, and adaptive management, and above all else, collaboration, as we strive together to meet our goal in reducing the infections of malaria and mortality in Liberia. Thank you very much for your kind attention.
All right, special statement from CRS, Catholic Relief Services.
Now please welcome Ms. Kathy Ford-Saw, Head of the Africa and Middle East Department of the Global Fund.
Kathy Ford-Saw, Middle East Global Fund, will possess the microphone for special statement.
Your Excellency Joseph Numa Boakai, President of Liberia, allow me to stand on the already stated protocol while recognizing the honorables and excellencies at the high table, but also civil society actors and communities. We are who we are because of the communities of Liberia. Distinguished guests, all protocol observed. My team often says, where we see you, it's because there are bad news. But today, I'm not here because of bad news, but to celebrate good news. So I would like the energy in the room to be upped a little bit. I would like to express my heartfelt thanks for the warm welcome to Liberia. We are delighted to be in Monrovia for the launch of the Global Fund grants worth 93 million United States dollars, a combined HIV and tuberculosis grant, as you have heard just now from our colleagues from Plan, totaling 45 million United States dollars, but also a malaria grant amounting to 48 million US dollars, as stated by our colleagues from CRS. Your Excellency, allow me to take this opportunity to share our sincere appreciation for the leadership and the renewed commitment of the government of Liberia in the fight against the 3 diseases and in building resilient systems for health. I would like to particularly recognize the Ministry of Health Engagement under the leadership of Honorable Dr. Louise Maplek-Poto. Let me also reiterate our profound gratitude to the Global Fund donors, whose continued support makes it possible for us to be here today to sign these grants. Our last replenishment showed their unwavering commitment with a record pledge of 15.7 billion United States dollars. In addition to 5 billion United States dollars to fight COVID and mitigate its impact on programs for HIV, tuberculosis, and malaria, which has allowed us to quickly react to a very new pandemic, including in Liberia. To the Liberia Country Coordinating Mechanism, principal recipients, bilateral and multilateral partners, civil society actors, private sector, and all other stakeholders in Monrovia, but also in the various counties that we finance. We are encouraged by your dedication, and we're encouraged by the support that you have provided to ensure the implementation of country health programs, but also Global Fund grants. These do not come without challenges, but success, as you have demonstrated, is possible. Distinguished guests, global health remains a priority amidst an increasingly fragile global economic context. Conflicts that are arising on various continents, competing urgencies like climate change. And we need to focus on moving strides in global health, but also in health in Liberia. The Global Fund, therefore, stands strong with Liberia and will continue to support the government's ambition to fight the 3 diseases and build resilient and sustainable systems for health, in addition to preparing for potential pandemics. During the last grant cycle, despite some hurdles, Liberia has achieved important results. And I would like to highlight a few of them, though Madam Kilikpo actually has already alluded to several of them. The first one is the reduced new HIV infections by 50%. But also a reduction in AIDS-related death by 67% since 2010. And I think we shouldn't underappreciate that, because these numbers matter. They're about people. They're about men that you know, women that you know, and children that you know. The percentage of people living with HIV who know their status has also increased to 74%. And the provision of antiretroviral treatment also has more than doubled in 5 years. For tuberculosis, which is the disease in my heart, the incidence has remained stable since 2015. And the overall number of TB-related deaths has seen a reduction between 2015 and 2022. But we are facing a potential rebound, and we need to refocus. Malaria has seen a 60% reduction in incidence rate and a 33% drop in mortality rate. And it's important to also mention that Liberia is moving towards digitalization, and the first ever digitalized campaign is actually currently ongoing. I wouldn't be true to myself if I didn't also highlight the essential work of community health workers in the response to the 3 diseases, and the government commitments to recognize the critical role that they play, but also the critical role of community health worker supervisors as part of the formal health architecture. This is a win. Your Excellency, much has been achieved in the past few years, but much more is yet to be implemented. If we truly want to make a difference in the lives of people of Liberia, we will have to jointly work together, believe that we have all the same objectives, which is that man, that woman, and that children in the various counties that you're from. The grants that we're signing today will be executed, as you heard, by Catholic Relief Services and Plan International, and we have vested in them a lot of confidence. You've heard both directors or acting directors committing themselves to working very closely with the Ministry of Health, and we will hold them to account for that. The subrecipient civil society organizations and communities will also have a significant role to play to ensure that those who need the services the most are the ones that are reached. The grants aim to contribute to Liberia's ambitious public health priorities and to reach the Sustainable Development Goals by 2030. I will not go through them. I also believe that they were covered. But maybe just to say that in addition to these grants, the investments that will be complemented by the COVID-19 repurpose funds for use by December 2025 will help further enhance laboratory systems and networks, human resources for health, community system strengthening, digitalization, surveillance, and the oxygen infrastructure. In an era where resources are becoming more and more constrained, complementarity, integration, sustainability should guide the execution of finance activities. This means ensuring that the responses to the 3 diseases is truly anchored to primary healthcare platforms. It also means strengthening key pillars to impact so that we can deliver quality services, improve access to diagnostics and testing for all Liberians with no one left behind, improve data visibility up to the last mile, avail key life-saving commodities in a timely manner, but also foster the overall governance that is surrounding the implementation of grants. Actors from all levels will have the arduous task to pursue optimization, value for money, and accountability, so implementation is efficient and followed by results and impact. We collectively owe this to the people of Liberia. Everyone in this room owes this to the people of Liberia. So we commit to a continued and robust collaboration with the Ministry of Health and other government entities, the principal recipient, and all partners so greater health outcomes are attained. The Global Fund's financing to Liberia, as my predecessors have alluded to, is complementary to the government's investments in health. And we appreciate the continued efforts to meet co-financing requirements in order to deliver on the national health objectives. The power of partnership through coordinated activities among development partners will also be key to greater impact and saving lives. Your Excellency, now my call is to you. I call on you to continue championing health as part of your developmental agenda and to sustain investments in health from domestic resources. Whether we are in the room with you or outside the room, I call on you to be the champion for health. And we stand next to you in your endeavor to have the health ecosystem also think, love, and build Liberia. We also stand next to you to build a better and brighter Liberia for your people. Let us leverage all opportunities for sustainable health investments in Liberia and hold ourselves accountable to effective delivery, results. And as we sign, launch, and celebrate past accomplishments, let us also reflect and draw the lessons learned from the last grant implementation that will allow us to move with resolve to deliver health services to the people of Liberia. And Liberia's achievements in the fight against the 3 diseases, but also in building resilient and sustainable systems for health, will then feed into a compelling narrative for donors during the next replenishment in 2025. Your Excellency, distinguished guests, we look forward to celebrating with you the successful response to these 3 diseases with domestic financing, funding from donors, funding from the private sector. We need to start tapping at their door, and these grants in June 2027. I wish the women and men of the land of the love for liberty remarkable success, and I thank you.
Excellent presentation there, coming from the Middle East in partnership with the Liberian government through the Ministry of Health and
We'll now
Social
call
Welfare.
on Madam Catherine Rodriguez, U.S. Charge d'Affaires, to make remarks.
Catherine Rodriguez, Charge d'Affaires of the, and she moves to the podium. She will take the mic and
Hear from Madam Catherine
address
Rodriguez.
Good morning,
gathering.
everyone. His Excellency Joseph Yuma
U.S. Ambassador,
Boakai, President of the Republic of Liberia, ministers, excellencies, ambassadors, heads of mission, donor partners in the health sector, including the United Nations system, invited guests, all protocols are being observed. It is an honor to join you today in celebrating a significant milestone in Liberia's journey towards a healthier future, the launch of the Global Fund Grant Cycle 7. On behalf of the United States, I extend our heartfelt congratulations to the government of Liberia, the Global Fund, and our development partners for this additional grant to continue our partnership in the fight against HIV/AIDS, TB, and malaria. Our shared commitment to these challenges remains critical to the lives of all Liberians. The United States, as the largest contributor to the fund, is proud to be part of the program's success and is grateful for your partnership. Like you, our commitment to global health is unwavering, and working together is the best approach to ensuring success. Our shared investment is yielding tangible results. Just to cite one example, in 2022, Liberia's malaria indicator survey shows a significant decline in malaria prevalence among children under 5, dropping from 45% in 2016 to only 18% in 2022. I commend the government of Liberia for being an effective partner in the fight against malaria, TB, and HIV/AIDS. Just as we share a commitment to supporting public health, we must also work together to ensure that every dollar provided by the Global Fund is accounted for and goes to the intended recipients, the people of Liberia. Talking about accountability is easy, but living up to that standard every day is something most countries, including the United States, struggle to do. However, I am confident the government will do its due diligence and put in place measures to ensure legitimate expenditures, diligent oversight, and timely, transparent reporting. Let's make this a grant model on how to do things right, beyond reproach, and a symbol of excellence of the remarkable work you all are doing and deserve. I want to thank the Boakai administration and the legislature for their efforts to increase the budget for the health sector. All Liberians benefit from a healthier society and not just a physical and psychological wellness. Investing in health is key to fostering economic prosperity. A strong public health system is a basic condition for a strong workforce. I urge all stakeholders, the legislature, the executive, and civil society to play their part in the effective implementation of these grants. Congratulations to the government of Liberia, the Liberian Coordinating Mechanism, and to the Ministry of Health for making this grant signing event a reality. As President Boakai has said, let's continue this journey with renewed vigor and determination to think Liberia, love Liberia, build Liberia. Thank you.
And Catherine Retro-Gas is the Shashi. She's the Shashi d'Affaires of the United States of
Thank you,
America.
Catherine. Just to quickly note, the United States remains the largest contributor to the Global Fund.
The program of both
In that sense, it's inception 2002. So we will now call on the civil society representative to the LCM, represented by Evans Addo.
Evans Addo, Civil Society representative, will take the podium.
Good morning, everyone. Your Excellency Ambassador Joseph Yunuma Boakai, President of the Republic of Liberia, kindly allow me to stand on the existing protocol to make these remarks on behalf of the civil society groups within the LCM. As civil society organization, we are very grateful to be here today to witness this historic signing ceremony of the official launch of the Global Fund GC7 grant, which we see as a step further to achieving the important activities that we do at the level of the community and as we do collectively as civil society. We also want to re-emphasize the way to achieve our goals as civil society. We need the strong political will of the government of Liberia. And how do that happen? There are policies that drive our implementation, and we want to ensure that we have the full support from the government of Liberia, as well as legislation, and we also need the support of our parliament. I see Senator Vapula is here, and we can assure you that collaboratively, the GC7 implementation in Liberia is going to be a success because we're going to employ all necessary innovative strategies to ensure that programs are reaching to those who need them. We must also work collectively with all our different partners because, especially for the HIV and TB grant, we take the multi-sectoral approach to ensure that all persons are available because the three diseases that have been mentioned here, it doesn't pick and choose. It cannot say because you are a rich person or a poor person or because you are in encyclopedia or you are in grain basket or compulsory. Malaria can attack anybody. So we should all put our collective effort together to ensure that the investments that have been made to Liberia by the Global Fund is being used accordingly and with the compliance and accountability and transparency. Because we as civil society will not keep quiet because we also want to ensure that no one will be left behind in the GC7 implementation. Thank you very much.
Speaking on behalf of the civil society organizations there, still want the remarks here.
Thank you, Evans.
We're expecting to hear from both the
proxy
finance minister
from the UNRC's
and,
office.
Honorable Dave Onatikofa, also the House Speaker, for the appears both are not in person. So, of course, we are currently in the final stages of our remarks, after which we will be joined by
Your Excellency,
who will formally launch this grant.
President of the Republic of Liberia, Honorable Minister of Health, dear Excellencies, all protocol duly observed. Please allow me to make a statement on behalf of the UN Resident Coordinator, Madam Christine, who is now attending the World Population Day. The government of the Republic of Liberia, in collaboration with the Global Fund, is working to strengthen the national health products supply chain to provide improved inventory management of pharmaceutical and commodity and ensure pharmaceutical and commodity security and also the availability of all pharmaceutical and commodities to all countries in Liberia. Today, we want to highlight the invaluable contribution from the Global Fund resources in making to improve the national response to HIV, TB, malaria, and the strengthening of the Liberia health system. If we look at the key achievements, which include the progress on the target for the HIV, the reduction of the malaria prevalence, as stated by the U.S. Ambassador, Madam Catherine, the improvement of the programmatic management of MDR-TB, strengthening the laboratory capacity in this country, but also improving of the supply chain management, particularly to ensure that essential medicine reach the last mile where they are needed and can make maximum impact. And to be fair, if you look at the Global Fund's grant for the health commodity distribution, allow me to thank the USAID for the contribution made by USAID on the management of the CMS, because the United Nations through WFP has been implementing the downstream transport, ensuring that health supply chain from this 10 health program move from the Central Medical Store to the 15 countries across the country, targeting around 180 health facilities, including hospitals and regional depots. But we need to ensure that, like we talked, like Honorable Minister of Health, from that the President, the Excellencies, really want to ensure that the medicine reach the population in need. And I know you have that from the bottom of your hearts. And I want to tell you today that WFP, the United Nations, is committed to support you to ensure that all the medicine that we deliver reach the population that in need in the countries or in the depots. Thank you. Therefore, the UN country team, through its specialized agency, will collaborate with the Global Fund and the government of Liberia to contribute to the control and the elimination of this targeted disease to meet the SDG target by 2030. Thank you, Excellencies. Thank you, Honorable Minister. Thank you all.
Thank you, Dr. Aliudong, WFP Country Rep to Liberia. We will now have remarks by Honorable Anthony Myers.
We want to first say thank you for staging this event. It is no doubt that these three diseases know no boundaries, they know no timelines, they don't respect budget cycles. The infection rate will not lapse at the end of the fiscal year. So it is critical that, as the chair of the coordinating mechanism noted, that the funding mechanism, a co-financing mechanism in budgetary terms we call a counterpart funding arrangement is in place. So to begin with, we will in due course initiate conversations with the Ministry of Health to see the details of that as we get more information about the nature of the GC7 in terms of what that 15% translates into and how we can go about programming it within the context of our prevailing constraints. And events like this and programs like this give us reason to rethink our budgeting and funding process, because our current annualized budgeting format and long-term budgeting do not lend themselves well to tackling ongoing issues like the fight against TB, HIV, or malaria. So without much ado, we can say that as we also begin the National Development Plan process for the next 5 years, we will also be engaging with the Ministry of Health and other partners in the health sector to ensure that we can have a more programmatic approach to funding the health sector, if not the entire sector or all of the activities in the sector, critical programs such as the one for which we are here today. So, Madam Minister, and Madam the Director of the Regional Global Fund Program and the Chair of the LCM, and the President is here, but I'm sure you agree that I can say on behalf of the government, you will be our partners, as we've always been, despite all of the challenges and constraints. This is something that the Ministry of Finance, working with you and other stakeholders in the sector, we will be a part of. I say thank you very much.
All right, Anthony Deputy Minister for Fiscal Affairs at the Ministry of
Thank you.
Planning.
At least when we're discussing co-financing commitments, we know where to go. The Minister of Foreign Affairs will now be represented by Honorable Karishma Pelham-Wright, Assistant Minister for International Organizations.
Karishma Pelham, deputized for the Minister of Finance, Sarah Beslo Yanti.
His Excellency President Joseph Boakai, President of the Republic of Liberia, advocate for the health and well-being of the Liberian people. Permit me to stand on all existing protocols. I am deeply honored to bring you warm greetings from Her Excellency Madam Sarah Beslo Yanti, Minister of Foreign Affairs of the Republic of Liberia, who would have loved to be here today, but is catch up with other engagements. And having trusted me with the privilege of delivering a short remark on this official launch of the Global Fund Grant Cycle 7 for the Liberian people in response to AIDS, TB, malaria, and health system strengthening. Ladies and gentlemen, it is with great pleasure and a sense of profound responsibility that I stand before you today on this momentous occasion, the launching of the Global Fund Grant Cycle of Liberia in collaboration with the Ministry of Health and our esteemed partners. This initiative marks significant milestone in our ongoing efforts to combat HIV, TB, malaria, and strengthening of our health system across Liberia. The challenges we face in addressing these health issues are formidable, but so too is our collective resolve to overcome them. The Global Fund's support represents not just financial assistance, but a partnership rooted in solidarity and shared commitment to improving the health and well-being of Liberians. Through this grant cycle, we will enhance our capacity to provide essential healthcare services, reach valuable populations, and scope of interventions that have provided effective in combating these diseases. It is our opportunity to innovate, collaborate, and accelerate programs towards our health targets outlined in Liberia's National Strategic Plan. I commend the Ministry of Health and our dedicated partners for these tireless efforts in preparing for this moment. Your commitment and dedication are vital as we navigate the complexities of healthcare delivery in Liberia. As Assistant Minister for International Organization, Ministry of Foreign Affairs, I pledge our continued support to this vital collaboration. We will work tirelessly to ensure effective coordination, transparency, and accountability in the management of these resources together. We will strive for impact and tangible improvement in the lives of those we served. Let us seize this opportunity with optimism and determination. Let us honor the trust placed in us by the Global Fund and our partners by delivering results that make a lasting difference. Together, we can achieve a healthier, stronger Liberia for all as we think Liberia, love Liberia, and build Liberia. Thank you.
As we think Liberia, love Liberia, and build Liberia, she was deputizing there for the Minister of
I'll now call on Councillor Oswald Twere, Attorney General of the Republic of Liberia and Minister of Justice.
Minister of Justice and Attorney General of the Republic of Liberia, Councillor Twere, mounts the podium.
Mr. President, members of the Democratic government ministers here present, including the Minister of Health, officials of government, our partners and friends here present, members of civil society, good morning. Today is indeed a great day for the government of Liberia as we come here with the President to launch the Global Fund Grand Cycle 7. Through this initiative, our government people have been helped a lot in combating HIV, TB, malaria, and in helping and strengthening our health system. We are indeed grateful. In this public manner, we want to commend the Ministry of Health, the employees, the health workers, and the fund itself for this great help to our nation. As one of the line ministry within the membership of the LCM, we want to ensure the global fund, and we do all as a government to ensure transparency and accountability as we deliver to the people of Liberia. We have to continually stress this point because, as the Charge d'Affaires of the U.S. Embassy said, it's easier said than done. We have to always keep it foremost in our minds, allow people to understand that there is a new day. It cannot be business as usual. We have to be accountable and transparent. So we pledge our support. Again, we say thank you, especially the Global Fund, for helping our country and people. Thank you.
Councillor Twere, Minister of Justice and Attorney General of the Republic of Liberia.
Thank you, Minister. It gives me great pleasure to call the Senator of Grand Cape Mount County and the Senate Chair on Health, Senator Daba Vabla.
Senator Daba Vabla, Grand Cape Mount County, and Chair on Health at the National Legislature. I will also come up to address this gathering.
His Excellency President Joseph Boakai, Minister of Health, Mrs. So, our guests and your team, cabinet ministers here, development partners, particularly those who work with us in the sector, the fourth estate, ladies and gentlemen. It is an honor for me and a pleasing opportunity to participate in the launch of this cycle 7 of the Global Fund. In April, during the celebration of the World Health Day, we gathered as health actors and made a commitment to reduce the number in maternal and newborn health, many of which are due to the 3 diseases that the grant supports, and also the weakened health systems, especially in rural Liberia. Over 20 years of partnership with Global Fund and the investments made to our health sector, we are very grateful. All of the numbers, the indicators that have been mentioned here, reduction in malaria, reduction in HIV, are all due to our collective efforts. So let me say thank you, particularly to the health workers. I am particularly pleased to welcome you, Mrs. So, having met you in Geneva, and we sat and had discussion about your last visit here. Thank God today, this visit is the direct opposite of the last one. On behalf of the leadership of the legislature, we want to recommit our support to ensuring that we work with other relevant ministries and agencies. I'm happy that the Minister of Finance is represented here, to ensure that we firstly increase and expand our revenue envelope, and then appropriate significantly to health sector. As Ms. Killable mentioned, all of these grants will be coming, but domestic revenue should be appropriated to the needed health sector. And we are committed to doing that. I think the first budget demonstrated an increase, and we look forward to more increase. Mr. Minister of Finance, you just touched the point that I wanted to say. When we met at the legislature, especially the House of Senate, on January 15th, we all recognized the need in the strategic areas. And one of those areas that stood up was the health. If you don't feel the brunt of the weakened health system in the communities, in the counties, we do as the people's representatives. Because we are there with them when we see a pregnant woman show up and there's no generator to run electricity in the delivery room if there's a clinic in that community. These are things that touch us. We made a commitment that we will work with all of us in the appropriation cycle to go back to program-based budgeting, which makes oversight easier, accountability easier. And to the civil society, we are partner in this. We are going to quickly start inviting you to begin our engagement in some of those legislations that we met that have not been finalized, so that we can start a conversation around it. And working with the leadership of the both houses, you can be assured of us working hard alongside you, the Ministry of Health and other health workers, to make sure that those legislations are passed. Having said that, I want to say congratulations to all of us, and we want to assure you of the transparency we told you. We told you that we'll be accountable for these funds, and we said that with all of our passion, and we'll do that. Thank you.
Well said. will see the chair and health of the National Legislature. And this is a clear indication that the next speaker will be His Excellency, as it is indicative from the podium of the presence of Emmett Kennedy, the Chief of Protocol at the Executive Mansion.
Madam Chair, President of the Senate Committee on Health, Madam Minister of Health, members of the Cabinet, and other officials of government, dear President, members of the Diplomatic Corps, former officials of government, heads and representatives of international and local non-governmental organizations, our development partners, civil society organizations, members of the press, distinguished ladies and gentlemen. It is my pleasing duty at this time to present to you His Excellency Joseph Boakai.
And His Excellency the President has been announced. The audience will come to their feet as His Excellency will address this honorable body.
Good afternoon. Please have your seats.
President takes the podium and he addresses the audience.
I leave here today with two things in mind. We already asked the CSA director to take note of all the commitments that have been made here, to be able to remind them. And the second thing is that everybody who has spoken here except for Kennedy has standing on existing protocols, and nobody had refused. When Kennedy speaks, all protocols will be duly observed. We want to say by the Minister of Health, Dr. Louise M. Puto, the Minister of Health Family, the representative of the NGO community, representative of our partner governments and institutions, foreign diplomats near our capital, our hard-working medical professionals, esteemed guests, members of the media, distinguished ladies and gentlemen. It is with immense pride and deep sense of responsibility that I stand before you today to officially launch the Global Fund Grant Cycle 7 in Liberia. This significant occasion marks a renewed commitment to combating the epidemics of HIV, tuberculosis, and malaria, diseases that have for so long plagued our nation and hindered our progress. The government and the people of Liberia remain eternally grateful to all our funding donors of the Global Fund who make their work possible, making lives healthier and longer. The Global Fund has been an invaluable partner to Liberia over the years, supporting our nation's development agenda by contributing tirelessly to our healthcare system, providing crucial support in our fight against these deadly diseases. The GC7 grant is a testament of the Global Fund's unwavering dedication to improving the health outcomes in countries like ours, where the need is great, the challenges are many, and opportunities few. This grant will not only consolidate the gains we've made over the years, it will also strengthen and accelerate our national response to HIV, tuberculosis, and malaria. As we embark this new phase of our partnership with the Global Fund, it is crucial to acknowledge the significant strides we made thus far. Through previous grants, we have expanded access to essential health services, increased the availability of life-saving medications, and improved our healthcare infrastructure. Yet, we recognize that much work remains undone. The GC7 grant will enable us to build on these achievements, ensuring that our healthcare system is more resilient, efficient, and accessible to all Liberians. Our commitment to improving healthcare is unwavering. We will continue to prioritize training and capacity building of our healthcare professionals, ensuring that they have the skills, resources needed to provide high-quality healthcare. Moreover, we will invest in strengthening our supply chain management system to ensure that medications and medical supplies reach those who need them most in a timely and efficient manner. The fight against HIV, tuberculosis, and malaria requires a comprehensive and coordinated approach. Through the GC7 grant, we will enhance our prevention, diagnosis, and treatment efforts for these diseases. We will implement and innovate strategies to reach key populations, reduce stigma and discriminations, and promote community engagement and ownership of health initiatives. For HIV, we will focus on scaling up retrovirus therapy, expanding access to HIV testing, counseling services, particularly to high-risk population groups, and promoting HIV prevention measures such as condom distribution and awareness campaigns. We will also prioritize interventions to prevent mother-to-child transmission of HIV, ensuring that every child born in Liberia has the opportunity to grow up healthy and HIV-free. Furthermore, we will improve multi-sectorial coordination and promote sustainability of HIV response under the oversight of the National AIDS Commission, which I head. In the fight against tuberculosis, we will strengthen our diagnostic capacity, ensuring that all individuals with TB are promptly identified and treated. We will also enhance our efforts to address the multi-drug-resistant TB, providing specialized care and support to those affected by this challenging form of disease. Malaria remains a significant public health challenge in Liberia, particularly for our most vulnerable populations, including pregnant women and young children. Through the GC7 grant, we intensified our efforts to distribute insecticide treatment bed nets, support our national malaria control program, and stakeholders at all levels to ensure timely diagnosis and treatment for malaria cases, and ensure timely, complete, and accurate data for decision making. We will also continue to promote community-based interventions, empowering individuals and communities to take an active role in malaria prevention and control. A special focus will be on the reduction of gender and human rights-related barriers to optimal malaria prevention, testing, and treatment services. All grants, HIV, TB, and malaria, will share a common vision of supporting resilient and sustainable systems for health with cross-cutting integrated interventions aligned with government policies and priorities. Areas of our focus will include strengthening our supply and chain system, network of laboratories, community system strengthening, health financing system, monitoring and evaluation system, and health sector planning and governance for integrated people-centered services. While the support from the Global Fund is instrumental in our fight against these diseases, we recognize that sustainable progress requires collective effort to ensure national buy-in ownership. The government of Liberia is fully committed to addressing the gaps in funding and ensuring that our co-financing commitments are met. We will work diligently to mobilize domestic resources, strengthen our financial management systems, and foster partnership with other stakeholders to secure additional funding for our health programs. We understand that the path to achieving our health goals is not without challenges. However, we are resolute in our determination to overcome these obstacles and build a healthier, more prosperous future for all Liberians. Our government will continue to prioritize health as a key pillar of our national development agenda, recognizing that a healthy population is the foundation for sustainable development and economic growth. As we launch this Global Fund Grand Cycle 7, I call upon all stakeholders, government agencies, development partners, civil society organizations, and the private sector to join us in this critical and crucial endeavor. Together, we can create a Liberia where no one is left behind, where every individual has access to quality health care, and where we can look forward to a future free from the burden of HIV, tuberculosis, and malaria. In conclusion, I extend my heartfelt gratitude to the Global Fund, its doctors, donors, and all partners who have stood by Liberia in our journey towards better health. Your unwavering support and commitment are making a profound difference in the lives of our people. Let us seize this opportunity to reaffirm our collective commitment to health and to work tirelessly towards achieving our shared vision of a healthier, more equitable world. It is in this light that I take such great pride and deep satisfaction to announce that the total approved amount given under the grant for Liberia to accelerate the fight against HIV, tuberculosis, and malaria, and to strengthen our health system. The amount is $117,546,670 United States dollars. 117,546,670 million United States dollars. This substantial investment underscores the international community's confidence in our ability to turn the tide against these diseases and transform our healthcare landscape. And we marvel at the size of this donation and print towards the set target. Let me remind you that the best way to acknowledge, appreciate, and thank the donors will be judicious, smart, frugal, transparent, and purposeful in the use of their donation. I trust we can and we will do just that. Thank you, Global Fund. Let's do justice to this noble mission as we thank Liberia, love Liberia, and build Liberia.
Shortly signing this, but yes, the program continues on
Thank you, Your Excellency.
Mansion City Hall.
The President of the Republic of Liberia has highlighted the Global Fund's contribution to Liberia's health system strengthening. And the government is fully committed to addressing the gaps in funding and ensuring that our core financing commitments are met. Not only will the grant facilitate the gains we've made, it will also strengthen and accelerate our national response to HIV, TB, and malaria. Thank you, Mr. President. We'll now move on to the presentation of the symbolic check and the signing of the Global Fund Grant Cycle 7 by the Honorable Minister of Health, Dr. Luis Nkoto, and Mrs. Kathy Folksville, head of the Africa and Middle East Department of the Global Fund. The signing will be witnessed by His Excellency, the President of the Republic of Liberia.
As you heard it, the signing and presentation of the symbolic check. The presentation will be made, and the symbolic check will be signed in the presence of His Excellency, the President. And if you're just joining us, we would like you to keep viewing, keep your comments coming in, keep viewing. We come to you live on the Executive Mansion online platform, right here from the Mansion City Hall. Program is being witnessed by His Excellency the President, and the check will be signed and the presentation will be made. It's a full house, a good number of stakeholders at the Global Fund, and you see the exchange of documents between the Global Fund and the government of the Republic of Liberia, as His Excellency watches on. He looks on, he's the President of the Republic of Liberia, and he's been sandwiched by the both signatures, and the documents have been signed and handshake as is. All right, the check, that symbolic check, has been posted. All right, and the show you viewing. Keep viewing. Keep your comments coming in. Yes, it's another step in the right direction. And His Excellency retires, and he moves to his seat. He moves.
Over 106 billion is the total amount budgeted for the GC7 and will be implemented by Plan International and CRS.
It will be implemented by Plan International and CRS. And we're still here at the City Hall.
President of the Republic of Liberia,
Minister of Health.
Boakai, distinguished guests, health workers of Liberia, all protocol observed. First and foremost, I would like to express my deepest gratitude to His Excellency the President Joseph Boakai Sr. for his unwavering commitment and inspiring words. Your leadership, Your Excellency, and vision are vital to the success of our national health initiatives, and we are immensely grateful for your support. To our distinguished guests, donors, including members of the government, international partners, civil society representatives, and all stakeholders present here today, thank you. In our Liberian language, we say, yeah, thank you, yeah. Your presence underscores the collective determination we share in the fight against HIV, TB, and malaria. And in strengthening our health system, your participation is a testament to the power of our collective and shared goals. I extend a special thank you to Mrs. Cathy So, the Global Fund team, and our donors for their unwavering support and continued partnership. The symbolic check and the signing ceremony we witnessed today mark a significant milestone in our history towards a healthier Liberia. Your contributions have been and will continue to be instrumental in our efforts to combat these diseases and enhance our health infrastructure. To the leadership of the Liberia Coordinating Mechanism, our esteemed partners in civil societies, thank you for your dedication and hard work. A heartfelt thanks to our partners, Plan International Kidney Release Services. I trust that your collaboration with the Ministry of Health and the government of Liberia will bring substantial benefits to the people of this country. I would also like to acknowledge the tireless effort of the organizing committee and our eloquent MC here today. Mrs. Christine Brooks Jarrett, my policy advisor. Thank you. Lastly, but not the least, to the people of Liberia, this day is a testament of our resilience and determination. Your health and well-being remain in the heart of our endeavors. We are committed to ensuring that the benefits of the Global Fund reach every corner of our nation, improving the lives and building a healthier future for all. I want to say thanks for your presence as we all think Liberia, love Liberia, and do Liberia.
Right here, to say thanks for being there.
Thank you, Honorable Minister. My own official time says it's 12:40, and by the growling in my stomach it's lunchtime. So I would now like to say a big thank you to all of us, and a very special thanks to His Excellency, the President of the Republic of Liberia, and our esteemed platform guests. We will now call on the protocol.
And the protocol.
Thank you, Madam Jarrett. At this moment, we'd like to go into the photo opportunity, and we would like to begin with the high table. So, with the exception of His Excellency, the rest of us, please come down for the photo op.
All right, the photo shoot.
After the show have gathered, then the president will come.
All right. Photo shoot with His Excellency. Will be done. The photo shoot. Photo shoot. Just stakeholders will be done. And they will be coming as His Excellency will. All right. There it goes.
Thank you. At this time, senior officials of government and members of the diplomatic corps join the photo.
Right.
Senior officials of government, cabinet officials, please.
Senior officials of government. Diplomats. I see the Shashid affair at the United States Embassy accredited here in Malaysia, and other senior officials of government.
And Senator, please join. Please return. Our partner of the Global Fund.
Partners,
return
Global Fund.
Stand, please.
Other dignitaries.
They will actually join you. Thank you. The rest of us will retire, leaving members of the high table on the stand while the health partners join.
Health partners. Will be next. The crisscross. The crisscross are.
This is only the health partners.
Health partners.
Please come.
There's a photo shoot with His Excellency, the President.
The ministers help them over the lines after the health partners.
No.
Thank you. Thank you. With the exception of senior members of the high table, the rest of us will retire and will now invite the Minister of Health Family.
You want to go on
the Minister of Health Family.
Minister of Health, Family.
CJ, come on, please. Chief, please, rapidly.
It's been a worthwhile program. We're having some challenges here with our
Thank you. Thank you, Minister of Health Family. We shall now call the LCM. This is the letter to the photo of which part is residency. The LCM.
LCM. His Excellency, the President is still put. Still put.
Thank you. So we
Photo shoot.
So after this one will be the Global Fund dedication to Liberia. Thank you very much. The Global Fund dedication will close the photo opportunity.
Global Fund.
So the members of the high table will remain standing while the Global Fund dedication John the photo.
Global Fund delegation.
Thank you very kindly. Since my end of the program, shall we all rise and remain standing near our seats as members of the high table accompany His Excellency out of the room. Thank you.
All right, you heard it? His Excellency will be escorted out of the hall.
Please clear the aisles and remain standing near your seats.
His Excellency, the President, is being escorted out of the hall. And I'm telling you, wherever you've been watching from, we'd like to say thanks a million for being a part of this program. We've been coming to you live from the ballroom, the Monrovia City Hall, bringing you live broadcast of the official launch of the Global Fund Red Circle 7.
May I have your attention, please? So launch the
Thanks a million for being a part of this event. On behalf of the entire team,
senior officials of government, the diplomatic corps,
from the Executive
launch to
Mansion,
be served right in this
the entire team of the Executive Mansion online platform, full up to find ahead.
Thank you.
We also have Kavette Fambule, Samuel Zoll, Joe Blackie, Joe Ama, as well as Abraham Kabake and the rest of the team. My name is Emmanuel Kipa. I would like to say thanks a million. Until we catch you another time around. You have a pleasant time. Bye-bye.